community nurse.
Great, thank you, and welcome to the hearing. Thank you so much for making time to come and give us evidence today for this review. We have some information about your organisation on the screen there. Is there anything that you'd like to add to that, or any more detail that you'd like to give us about what family nursing and home care does?
I think I'd just like to emphasise that family nursing and home care see every child across the island at different stages. So from an antenatal visits right the way through universally. So there's some targeted services right the way through to school, and then we're lucky enough here in Jersey to have school nursing for the primary schools and secondary schools across the island. So we do have a continuity with the families and the children.
Yeah. I think it's the only universal under fives. I think maybe apart from the GPs now, because now the GPs are free, but family nursing, over the years has consistently been that sole kind of universal under fives, hasn't it? And how many families do you support annually? I know you're probably going to say all of them.
Yes, all of them. So it's about 18,000 children, so under 18. And of course the antenatal.
Yeah. And how many under fives is that?
It's about 1,000 a year, although as we all know, the birth rate's dropped at the moment to 700. 700. Yeah. So it's for all of those, it's about 4,500, 4,300.
Okay, so it varies. So this review, of course, is focused on the parts of the employment legislation, which are called the family-friendly employment legislation. So there were some changes made in tranches. Can you tell us whether your organisation has had to change in any way, or how that change in the law has impacted you?
Yes. So at family nursing and home care, the only elements of the law that we haven't yet introduced is with regards to zero contracts. We will change it in regards to parental leave, but we have a lot of nurses who prefer to have a zero contract because then they're in control as to when they work and when they don't. So although I can understand societally why it's not perceived as a positive contract, it is very much in the hands of the individual. And we don't always have availability for them to work because we have got a full staff at family nursing. So
how many staff do you have?
It's about 180 at the moment.
Gosh, okay.
But we will change it so that all of the zero contracts, and I think there's only two, we will provide parental leave. Yeah. But in all other respects, we've adopted every aspect. Okay. We provide all the benefits like continued holiday accrual, etc., through through parental leave. Yeah. We don't provide allowances, which is things like the car uniform allowance and that sort of thing, which would be normal.
Okay, thank you. So obviously employing 180 people, so you've just given an answer there as an employer. Most of the questions that we have ask for your evidence as an expert in children of Jersey, and obviously your professional background give you that as well. So in terms of the services that you're delivering to families, and then, for example, are there more dads at home now that the leave is equal to dads? How has your service had to flex in response to those changes?
Not only in Jersey, but internationally, it's been much more problematic to engage fathers in antenatal care, particularly with regards to work. Because they're often at work when we're providing our baby steps classes or any antenatal classes. I'm really happy to say that we are doing extremely well here in Jersey. We have got a very good uptake, and I can't quite remember the statistics, and I don't want to give you a false one, but it's very high. Yeah. A connection with fathers attending antenatal classes prior to the birth of the baby.
That's great.
So, yes.
Like the baby steps.
Yes.
Yeah.
And about 80% of all expectant parents are attending baby steps across Jersey for their first baby.
Okay. And has there been any change in that or in the fathers attending
Yes.
since the law was changed?
Yes. Now, it's also been accompanied by some really good marketing, if you like, to ensure that fathers are engaged and to ensure that as healthcare professionals, we are including the fathers in the health assessments and the family assessments. And historically, I don't think that happened as much as it does now.
Okay, all right, just have a go. Sorry, we had a slide that had the law set out, so we're going to see if we can get that on the screen. There we go. Yes, so this is just a reminder for us all of what actually the changes were. So looking at that, do any of these elements of change in the law have they impacted your service delivery and what you've been delivering to families?
For certain. We don't have many men working in our services, but those that do, this year we have provided parental leave.
So in terms of the service delivery rather than as an employer, like what, are families doing things differently? When you go into the homes, sure. Is anything different as a result?
For sure. There's much more sharing of the care of the baby because they're able to be present in a way that historically they just weren't. Mm-hmm. They might have had 1 or 2 days leave. Well, it was very dependent, of course, upon their employer. Yeah. But now it's well versed the fact that majority of male and female employees can get access to being at home to look after the children, the babies for longer.
So you're seeing a culture change,
yes,
as a result of this legislation. Yeah, that's really positive. Yeah. Really,
it's definitely positive. Yeah. We can also. Can I go on to other areas?
Please do. Yeah.
So I don't know if you've seen the breastfeeding figures for the last half year, but 4% increase. And in my career, and I hate to think how many years that is now, but it's in excess of 30, and I have never known an increase in breastfeeding of 4% in such a short period of time.
It's more great news.
It's just fantastic. And so I know, in Jersey, we've been working incredibly hard to increase, and employers have been working hard to make facilities available. Yeah. But nevertheless, that's still quite a significant increase. Yeah. But we do still have an issue with regards to making awareness higher, so that young families are identifying what they are able to apply for.
Awareness of what's in the legislation. Okay.
Yes. Yeah. So we introduced some awareness raising through our Baby Steps programme and with our health visitors, so that we can, and our MESH programme, which is a targeted sort of health visiting service. Yeah. All of those services are very focused on ensuring that the families are aware of their entitlements.
Okay. So do you feel you do a lot of passing on information about what is actually out there
available, and it's on our website, and so it's really important that people know what they can.
And when you're passing information on, is it about this employment legislation, or is it more about the social security benefits, or is it both?
It's both. Okay. It is both. It's complicated. They've got a lot going on becoming new parents, and so understanding all the nuance of the law and what the entitlements are is difficult for people to navigate.
Yeah, I think so. We'll come back to some of these themes, I think. In terms of your community support, we had the Jersey Childcare Trust for a hearing, and they referred to you as their eyes and ears in terms of what's happening with families. Can you tell us a bit about some of the common challenges for young families in Jersey, or families raising very young children in Jersey?
It's a huge transition to parenthood. And so there's a whole raft of different adaptations that you have to make. And the first, of course, is financial and emotional, but it's also physical with regards to housing. So I would say from our experience, it's about finance, and it's also about rent and accommodation. Those are the two big factors that we come across time and time again. With regards to childcare, we've got, on the whole, maybe this is because the birth rate's dropped, but we on the whole have got sufficient nursery places for those preschool years. But the cost is enormous. Now, Jersey's very good with regards to getting a tax rebate, but it's retrospective. So if the parents are both back at work and the baby or the young child is going to nursery, then they have to put that money forward and then claim it back. So to my mind, it's the wrong way round. It needs to be that the families are supported with their choice about whether to go back to work or whether to stay at home or whatever circumstances. But the finance shouldn't be driving those decisions to the extent that it is. So in Jersey, that is a very pronounced influencer.
Yeah. Okay, so in terms of, so I'm just trying to equate some of these challenges to this law that we're focusing on. So you mentioned financial challenges as being one of the biggest challenges to families. And obviously the changes here did increase the paid leave that is now available to families. Has that helped enough with those financial challenges?
Well, it's never enough, really. But if you look at it with regards to the cost of living here and the cost of rental, I would probably argue it needs to be greater to cover that increased cost. If you do a comparison with London, which is an expensive part of the world to live, Jersey's still coming out as, if not on a par, more expensive. So you then have to think, well, benchmarking, probably it's not enough. If even when you take the tax into consideration, and I've got stats around this because I wanted to be really clear, but we have got higher salaries here on average after tax of about 14.9% difference with London, but nevertheless, groceries, phone, rental, they're all massively higher, and all things that these young families will be needing with the raising of the children. So there are a significant tranche of families who are really struggling.
Yes, and we heard from...
I was just going to say, when you say a significant tranche, would you be able to put that in a percentage term?
It's circa 20%.
20%.
Yeah.
Okay.
When you say really struggling, what does that look like?
It to the point where they're looking at what food to put on the table, how to pay rent, getting into rent arrears, not having. I know we live in a beautiful island, but it's still not having downtime from work so that they can have some holiday and a break and some family time that's often expensive. So really fundamental things that you need as a young family. Transport costs. All of these costs are high. So families do struggle. There's no doubt about that.
That paints quite a bleak picture, and it echoes what Brighter Futures said to us, which the panel found quite shocking. In terms of this legislation, then, what do you think that how could this legislation be changed or improved to help those families that are most struggling?
To my mind, it's not just about giving financial support. It's about giving a plethora of different choices. So it might be financial, but it might be that actually what they need is some space at a nursery. So having some capacity to have some nursery space each week, but without a cost associated with it, or looking at a proportion of rent. It's those everyday, really, really basic stuff, but that actually helps their bottom line in a real way, rather than providing an increase in a parental allowance, which you get once and then it's gone. You need that sort of continuous, not big flood of money, drip money that helps on a week in, week out basis in those first couple of years for sure.
Yeah, so in a way, helping to address there's a different, if I could put it in this sense, there's a time, money, energy equation in most people's lives, but at different stages, there are different angles and different pressures on those three factors. And young parents generally tend to experience the most stretched period, or they have the energy perhaps, but they're most stretched with the time and the money factors in life. So it's perhaps looking at areas where you can reduce those pressures on the time and the money factors.
That's in line with their needs, so that it's not prescribed by external people such as us or any government or whomever, but it's actually aligned to their needs in a more meaningful way. But it's agile, so that it's at the end of the day, we have to be realistic. It costs resource from the states of Jersey, and we have to work out how to pay for that. But we don't want a society without 25% of our population being young people and children. It's so important for us to be forward-thinking and balanced as an island. We need to help it.
Yes, these matters may not reflect immediately in society, but a bit like the increase in breastfeeding rates, we will see in the future the potential positive impact on that cohort of young children as they grow up.
Yeah, in all sorts of ways, which are very, very meaningful for health and well-being.
Yeah. I thought it was really interesting, that question about the time, money and energy, and one potential policy idea that could address the problems you outlined, that around families not having enough time together and time for rest and relaxation and family time. Would something like a 4-day work week address any of those concerns and potentially childcare costs and things like that? How would
for sure.
that?
So it's about the flexibility. So yes, it's not. So often you hear people saying, "Oh, have 2 years at home." Let's say for the mum, let's provide a scenario of 2 years at home. But actually, that's not necessarily what that mum wants or needs. Particularly, she's got to keep up to date in practice. She's got to be worthwhile when she goes back to the workplace, however long it is, and supported in that. So to my mind, it's much better to have a flexible approach. So you've got perhaps not full-time, but paid full-time, so that financially she's not disadvantaged, but she's got a balance with family and time with the baby and childcare. So also enabling her to continue as an individual rather than a mum for 2 years and not have her independence in the workplace or whatever. So it is about flexibility, but it's a sort of like bag of all sorts, and for them to choose what is most meaningful to them as a family would, to my mind, be the best scenario.
Yeah, I mean, it seems like you have this really deep understanding of the issues that families are facing, and any of the potential solutions that might help them, do you feel that you are able to feed that expertise into government, and is that taken into account with policy making, or that understanding and knowledge that you have?
Some elements of it, but indeed there could be much more expertise fed in, for sure.
Yeah.
If I think about the expertise of some of our staff, the health visitors, when I think about safeguarding and child protection and all of the different elements of our work,
Yeah.
absolutely that could
Yeah.
could feed in more.
Okay, thank you.
But I'm not finding any closed doors, to be honest.
Yeah,
If I
that's
pushed
good.
on a door, it's pretty quickly opened.
Good,
So
yeah.
it feels quite accessible.
Okay, and in terms of that relationship with government, how do you report to government on the services that you provide, and are there any kind of formal mechanisms related to funding, etc.?
Yeah. We have performance meetings every quarter. We provide a performance report every month. And that looks at outcome-based accountability as well as data regarding number of home visits, the number of clients we've seen, how much face-to-face contact we've spent with different patients, whether they are children, young people, families, older people,
Yeah. Okay.
whatever the service.
Okay.
Yeah. So in terms of service provision, are there different levels of service offered to families who have twins or multiple births, or children who have disabilities or additional needs?
Yes, very much so. So you do your universal services to start with antenatally, and then you have what's called a Healthy Child Programme, which is so the family are visited within the first 10 to 14 days after the baby's born, and then at sort of 6 to 8 weeks after the baby's born, then at 4 months, when you're starting to look at feeding and nutrition. So all different elements are reviewed at different stages. You then look at 8 to 10 month development of the baby, or it sometimes goes into about a year, so that you're looking at that first year. Then we have a 2-year. I mean, we're really lucky in Jersey, to be honest, because we've got full complement of health visitors. We didn't have, but we have now. And then we have a 2-year developmental check. And now we've just this year introduced a 3-year developmental check, which was done on the back of a pilot because of COVID and the implications of development for the young child during the years of COVID. And I must say, it's quite easy to recruit health visitors here because we are doing proper health visiting here, which isn't really done in other jurisdictions because they're a rare breed. And so when you say to somebody who's trained to deliver this healthy child care programme that we are still doing that here in Jersey, and we're not all focused on child protection and court appearances, and it's very appealing. So because it's what should be provided and is evidence-based as best practice. So
good. That's good to hear. So over time, actually, the service provision has increased rather than decreased.
Yeah.
And could you identify what the reasons are for that? Is it political support?
I think it was, we were held to account and have been for the past, certainly this is my 5th year here in Jersey, but we've certainly been held to account during my time by our providers of our funds. You know, what are you doing? What's the delivery? So what, why are you not achieving X when so which is right and proper. And of course we're inspected. So, and we've got a passion to do the very best for families in Jersey. So there has been a stretch and there has been a real thought behind how can we do better? And so recruiting more staff was absolutely top of that list. And we did manage to entice. So, and of course you earn more here. So as a healthcare professional in the community, it's very appealing to be in Jersey. So I think that's helped. It's been a mixture of a lot of things. It's being held to account, which is right and proper. It's being aware of the needs here in Jersey and knowing how you can best address those needs. And it's also about the offer here in Jersey as a generic offer.
Have there been cases where you've put forward a case for additional funds to provide additional services that you see a need for, but had that denied?
Oh, yes, for sure. Plenty of times, yeah.
Yes.
There's plenty of needs out there, without question. We've just submitted a business case for a programme called Henry, which is about health and nutrition for the very young children, because we recognise through the monitoring of health and weight, which we do in the school nursing team, there is a real need to focus on nutrition and healthy activities for young children.
Yeah.
And we had it funded by the Jersey Community Foundation for 2 years, and of course that's just finished. And I had hoped to be able to show through the evidence that it's an evidence-based programme that we needed to do this in Jersey, as we've got about 28% of age group who are overweight with our children. But we haven't got that yet.
Right.
So there are definite needs. Looked after children is another area of concern, and child protection is another area of concern. So there's big gaps there, but the universal services and our targeted services are quite comprehensive.
Can you see that the universal services might come under pressure in order to find funding for those other needs and where there are gaps?
I don't think so. We've got a contract now for 5 years, and there's no talk of that contract being pulled back. So, and it's all evidence-based, so it'd be difficult to do that because the consequences would be significant.
Yeah. In terms of the obesity levels,
Yeah.
and this is erring slightly off topic, but just to pick up on the point that you made, in terms of the obesity levels and the lack of activity, what are the causes that you can see for this trend at the moment? And I think it is relevant actually because it's related
Starts
to
with
family
breastfeeding.
life, isn't
Yeah.
it? And the
Yeah.
pressures of that family life.
It really starts right at the beginning. So breastfeeding is crucial, and support with breastfeeding is crucial. Then if a mum is going, I say mum and dad or carers are going back to work and then getting home, picking up the baby or the young child from nursery, it's quite an ask to then put a really healthy, cheapish meal on the table. So it's really easy to go to inappropriate foods. And so then you can see, as the children are going through school, the weight gain is happening. So we need to get back to real basics. But people don't necessarily know what good looks like. So if they haven't got family support or to help guide with cooking, and they might not have the facilities in their home. So it's a real education to make sure that we go back to what a good meal, what a good, healthy, balanced diet looks like.
And level of activity,
Yeah, for
having
sure.
time
Yeah,
to
again,
exercise.
it's time. Yeah, which is why I said about that balance, about having family time, because that's very much part of the scenario.
And so it does come back to that time, doesn't it? So obviously the legislation allows, in theory, up to a year per parent to take that leave from work to spend the time with the child. And what we've heard is that people can't actually afford to do that. What's your comment on that, and maybe how that could be improved?
I absolutely agree with that comment. People cannot afford it. They've still got rent to pay or mortgages to pay. And we know how expensive that is. We know that food is significantly more expensive here, which is understandable, being an island, and cost of living generally. So that's when I think you bring in a suite of different solutions for the family. It's not a one-size-fits-all, and different things will suit different families at different times. So I think we need that approach rather than a sort of increased allowance of some. I don't think that will actually fit the bill. It's more complicated than that.
Okay. In terms of exceptional cases that your service deals with, such as postnatal depression or issues with attachment, failure to thrive, mental health issues, how do you escalate those cases, or does your service deal with them internally?
We have something called the maternal, it's an awful name, sorry, Maternal Early Childhood Sustained Home Visiting Programme. It's an Australian programme.
Is that the mesh?
Yes. And it's linked with the Best Start programme, and it improves child health and development. It's evidence-based again. It's a really comprehensive 3 home visits antenatally, and then it goes on to weekly visits for 6 weeks, and then fortnightly visits for 3 months, and then goes on to the age of 2. So really, really targeted support to that family. And it's really taken up well here in Jersey. So the people who need additional support on top of the Healthy Child programme, which I mentioned earlier, can get this service. And that's the core of health visiting, really. That real skill at understanding what the needs of that family are and addressing your service to fulfil those needs in any which way. So it's a fantastic start, but you need the other offers to layer it up.
Yes, so you would signpost to other
Yes.
support services
Yeah.
if they were identified as
Yeah.
being a requirement.
Hence the childcare trust and the. I'm just going to say Fiona, but so I can't remember the name.
Brighter Futures.
Brighter Futures.
Yes.
We refer on to both of those organisations, significant numbers of families.
Yes, and you have a risk assessment and safeguarding process.
Yes, oh yes, yeah, very much so. And we escalate through child protection. Not that often, probably 5 or 6 times a year.
Okay. Yeah.
But it has to be done, unfortunately.
Yes, but that's the benefits of having a universal access to every child.
Yeah.
Yeah.
And being in the home. It's quite different.
Yeah, so we've talked about some exceptional needs and families that might need more input from your service. What do you see in this law that could be improved for those families that have exceptional needs?
If I'm thinking about disability, and we have about 50 or 60 children in families across the island who have got significant need.
50 or 60, did you say?
Yeah.
Okay.
They have very specific needs, and we have our children's community nursing service that supports them in a health perspective. But we also, because we're a charity, we're able to support them with equipment. So, for example, specific mattress or specific chairs or other pieces of equipment. That's always quite difficult because some of the equipment's really expensive. So we struggle sometimes. Last year we bought one piece of equipment for one child, which was £6,000. So you're talking a lot of money. So having a facility to support that's quicker. Because you can't wait 2 weeks sometimes for these pieces of equipment. You need, and we can be agile. Being a charity, it's really fantastic. But sometimes you need other government-led decision making to be quicker and more agile. So and to have a fund that can be utilised for specialist need.
Yeah, sure.
Now, there is some of that, but it doesn't work quickly enough for us. Equipment's a big issue. So something in here that makes life significantly safer and easier for some families who've got specific disadvantage are needed.
Okay. So say, for example, parents have a child with significant disabilities. Let's look at the 52 weeks leave per
Yes.
parent. Is that long enough in those particular circumstances? Should there be any amendments made there to the length of leave?
I don't think generically, but it might be for that individual family. And we're only talking small numbers here. So, 50 or 60 families might need that to be extended. But again, that's going back to the agility and that framework of assessing. And you could say, well, we have that to a certain point, but it's just not enough. Okay. That does need to be extended because there's some significant complexity of need, which is getting higher and higher. The complexity of need is because of the advance of medicine. Yeah. Some of the children we're looking after have got very significant needs here in Jersey, and so we always are struggling to get money for equipment for them.
Okay, so improvements maybe outside of this law.
Yes, yes.
Okay. Returning to this law and maybe looking at some different types of families, single parent families.
Yeah.
Are they well served by this law? Could anything be improved?
I really struggle with the licenses for housing. Sometimes it might be that, and the tax situation, and I know that they've been addressed legally here in Jersey, but you still have circumstances, and I can give you a case study of one from last year, where the mum was working and pregnant. They then separated, and the tax rebate went to the father who hadn't worked. And that sort of situation still happens. So we have to get that right so that women and single parents they were newly separated, so it was a difficult situation from an administrative, but it really caused a hiatus for that newly single mum. And you do hear those sort of specific cases that we're not agile enough to be able to respond to. Yeah. So single parents here have a difficult time because of licensing around. The house might be in the husband's name and they may have separated, then she loses the right of ability to continue to live there. She has to find somewhere else, and then there's the cost. It's complicated. Yeah,
and we're talking about the financial struggles. The panel have noted some of the statistics around from the Joel's survey. It's in the 80s, I think, of single parents who are struggling financially. And looking at this law, so the leave is per parent. So actually, if you have a child born to a single parent, that child will only have the 52 weeks of a parent rather than for each parent. Yeah. Do you think anything needs to change?
Maybe that could go to another family member. I'm not biased, but to a grandparent, or to a brother or a sister who can help support, so that it just becomes again more able to respond to their individual circumstances. It might be that the father of the child, the baby, is still in that baby's life, but it might be that they're not. And in the cases when they're not, then that should be transferable, I would think, to another carer.
Thank you. Twins, we've
Yeah.
touched on. Is anything that you think could be changed in this law where a family have two babies or sometimes more?
So they get a parental allowance. My understanding is that they get that for the two or
Yes.
however many
I
babies.
think that's the only
That's,
thing that
but
actually
that is that's what I was going to go on to say. That is the only thing. So, they do need to have two sets of pretty much everything, and they've got two sets of nurseries. So I would think that the allowances should be accounting for that.
Yeah. What about the paid leave and the unpaid leave? Should that be flexed for twins? Or?
I would say so, but again, down to their needs. So if the mum wants to go back to work, then you've got the double nursery cost.
Yeah.
So again, you've got it's not because they're the same age, the same cost. That should be taken into account. And we want more babies here. So let's try and celebrate babies more and pregnancy and encourage as much as we possibly can.
Yeah, we heard from Brighter Futures that they said many of the families they work with have a feeling of shame around some of the problems around finances and wanting to provide for their families. How would you address that?
Well, giving them choice, putting the authority on the decisions with them, not being done to. So if they want to go back to work, and not feeling guilty for that. We've got some fantastic nurseries here in Jersey, and there's sort of a rhetoric that you shouldn't put a child in nursery before your year and all of this. There's cultural things that we carry without even realising. But I think that's unhelpful, actually. You've just got to think of the circumstance of the family and think, right, how can we best give them the power to make their own decisions? And if it doesn't work, be flexible enough to adapt.
Yeah.
So if going back to work isn't the solution that they thought it was going to be for that family, then all right, we can take stock, we can review. But not having carte blanche sort of decisions sitting with the family. But I think that if the family's in control of their decision making, that shame and that being done to can dissipate.
Yeah.
And our world here in Jersey very much being a supportive world for that family and for young children, so that they can have a sense of pride.
Yeah. We heard from our previous hearing that information around this legislation isn't always available in other languages. And you mentioned, you said that there was you had concerns around the awareness levels around the legislation. Can you make any comment around minority ethnic groups in the island and how this legislation is affecting them? Do they know about it? Are they accessing it?
Certainly in the baby steps, we have access to interpreters, and we fund interpreters from family nursing and home care. So and we use interpreting set, but we don't use it's a formal interpretation service, so we don't use ad hoc.
Okay.
If so, because they've got a family member who can interpret for them, we wouldn't use a family member.
Okay.
It's got to be somebody who is aligned to, so that terminology in health and that sort of thing is understood, because otherwise it could be interpreted wrongly.
Yes. And you said you were spending a lot of time informing families about this legislation. How could that be improved, perhaps by other services? Like what improvements would you like to see?
Well, it may well be that family nursing and home care could do more. We could provide more leaflets, perhaps in different languages, and go through. We don't have any health visitors, to my knowledge, that will perhaps speak Polish or whatever. But maybe we should look at that, so that we gain expertise in being able to offer services to people who are ethnically more marginalised here in Jersey.
Okay.
Maybe we could all do that. I think, it's about having an open mind, isn't it? And making sure that people have got the information that they need.
Yeah, there's always room to improve.
Yeah, there is.
Yeah. We've talked about the affordability of families being able to actually access this legislation. Do you think it's flexible enough?
No.
What would you change?
I would absolutely want... it says extend the right to request flexible working.
Yeah.
And for things like breastfeeding, I'll just give you an example of breastfeeding.
I've got a question about that.
My hobby horse. So you go back to work at 6 months and you're fully breastfeeding. Oh, fantastic. Big tick in the box. But then you can breast pump your milk, and you might have a fridge, but there's still pressures on that young mum to deliver in a way, because you're back in an office, it's a closed environment, there needs to be more pressure on employers to support. And I don't just mean lip service, I mean really support that breastfeeding mother in a way that is aligned to what she wants, not what the company wants. I'll give you an example. So going into the breastfeeding room in the office, leave your laptop. You're not allowed to take your laptop when you're going into the breastfeeding room. And you think, well, why on earth wouldn't you be allowed to if you're pumping for milk? It's stuff like that that is very sort of directive as to how you're going to breastfeed when you're in some work environments.
Okay.
And you sort of think, no, get rid of that sort of philosophy. Make sure that it's comfortable and that young mum is breastfeeding in an environment that she's comfortable in, and that she's doing, if it means taking her laptop in and that she's still working, and that's what she wants to do to take the pressure away, that's fine. There's no problem with that from a breastfeeding point of view. But by increasing pressure on her because she's in there perhaps for half an hour and then feeling that she's got to go back to her desk and that she's, it's just not flexible enough. And it's not really giving the support that it could be giving.
Yeah.
It's a bit more lip service.
What could that look like in the law?
It's probably around behaviours, so that you could have expected behaviours of employees.
Guidance.
Yes.
Okay. Okay. Sure.
And what would be acceptable and encouraged, and what wouldn't. Having it really outlined.
Yeah, that's helpful. Thank you.
Are there any other challenges that you see or your service sees when parents are returning to work after then parental leave?
I think the difficulty is you go back to work and it's full on. And there's very little support. It's just exhausting. And if you've had a disturbed night, which you're likely to have done, and then you've got a full week's work ahead, that's absolutely draining for a young family. So I think if we, again, it might be around some sort of directions for employers, but saying, be tuned in to your parents who are coming back, and work with them to look at a schedule that actually fits with them. If it's easier to have a flexible working from home and that sort of thing, well, as long as they're not engaged with childcare when that's different. But it is about flexibility, and it is about not being dogmatic. And there's quite a lot of dogmatic, oh, you don't do it like that, you do it like this. Well, actually, it should be the way it suits the parents.
So flexibility by default, perhaps, when parents go back for... Okay, that's interesting.
We've touched on the availability and cost of childcare, I think. Do you observe any other trends in how different groups, such as single parents, fathers, or low-income families, experience returning to work?
I know that it's difficult to do this because but social interaction develops a lot from the antenatal classes. So there's some social support with the families who've done their antenatal, but that's quite important that the couple have some ability to still be a couple rather than just, and I don't mean just in a pejorative way, but just parents. They've got to feed and nurture their own relationship. So anything from a sort of social perspective to help support them.
So Brighter Futures talked about the pressure on some parents who are playing tag, essentially, not playing tag, but operating in a tag team because they're covering the childcare, and so one's working a day shift, the other a night shift, and crossing over. Therefore, there is no time for that interaction as a couple.
So that'd be a really good example of, right, okay, put a full stop. What can Jersey do to help support that? So because that's not really long term. It's not going to work on a long term basis, and actually the pressures then build up in the home, and then you start getting other issues develop. So I think that's part of health visiting services, to go in and to talk about that sort of thing, and things like postnatal depression and your mood, and but tiredness is a massive issue for young parents, and there's not really enough awareness about the impact of tiredness on your mood, on your behaviour, on your child rearing. So that's something that we try and emphasise. But even if it's supported with employers' advice, having an awareness that these young parents coming back are going to be exhausted. Be kind, be supportive, and be aware.
That's really helpful. Thank you.
Copy that section.
Yeah. Okay. Wow, that hour went very quickly. We may have a couple of questions to follow up in writing, if that's okay, but I think we've covered most of what we wanted to ask in depth, and your answers have been so interesting and informative. Thank you so much for that. Thank you for your time. Is there anything that you wanted to add before we close the hearing?
I think really appreciate you doing this, because and having the interest to do it, because not many places do. So we should celebrate that. So no, thank you.
Right, well, thank you for the work that